السلام عليكم. بسم الله الرحمن الرحيم. محاضرة اليوم عن الأكيوت لمفوبلاستيك لوكيميا، تليها محاضرة ثانية عن الأكيوت مايلويد لوكيميا عن الدكتور حسين العتابي، فرع طب الأطفال، كلية طب الكندي. What is the acute lymphoblastic leukemia? Is a malignant disorder of lymphoblasts occurring as a result of indefinite clonal proliferation of single lymphoblast. لاحظوا single lymphoblast that has undergone malignant transformation. This is lymphoblastic clonal proliferation راح تؤدي إلى overgrowth and crowding out of the normal marrow precursor. The invasion of non-hematopoietic tissue and suppression of differentiation of normal cells causing ineffective hematopoiesis. بالنتيجة راح يصير عندي ineffective hematopoiesis. ALL is the most common cancer of the childhood. The big incidence occur between 2 and 5 years old, and it's more common in white and boys. So it's more common in white and boys. Now, what is the causes of the ALL? The causes of the ALL, it is unknown, may be associated with genetic predisposition. It is noticed in identical twins, Down syndrome, ataxia telangiectasia, Bloom syndrome, Musculoskeletal syndrome, congenital hypogammaglobulinemia. In addition to other causes, we have immune deficiency, as in ionizing radiation, chemical exposure, and immune suppressive therapy. Now, what is the complication due to the disease? Maybe due to the hyperleukocytosis، يعني الوايت بي سي تكون أكثر من 400,000، وهذه maybe lead to the stroke. يعني at the time of the diagnosis we might have hyperleukocytosis, not decrease white BC but increase of the white BC. Also we might have mediastinal mass, and this is usually seen in the T cells lineage, which can lead to the cardiorespiratory arrest. Tumor lysis lead to the renal failure and cardiorespiratory arrest, which because of the arrhythmia. tumor lysis tumor من ينهاجمه راح يصير بلايسيس، والتيومر هو عبارة عن abnormal was بإلكترولايت، بالتالي هذه الإلكترولايت راح تطلع تؤدي إلى renal failure or maybe arrhythmia. And also another complication, severe anemia, which can lead congestive heart failure, coagulopathy, which is lead to the stroke and hemorrhage, and hypercalcemia, as I mentioned before, above, which is lead to the renal failure and cardiorespiratory arrest. The febrile neutropenia, which is lead to the infection, stroke, and sepsis. The complication due to therapy, we have cranial radiations, the brain tumor, or learning deficient or growth retardation. بنكريستين دراك، هذا واحد من الكومن دراك، يسوي لي inappropriate antidiuretic hormone and hair loss. هذا اللي تلاحظونه دائما بدول البيشنت اللي عندهم لوكيميا. And also AL aspergillus lead to the pancreatitis, coagulopathy, adriamycin. ذول مجموعة من الدراج نفس العائلة. doxorubicin, daunorubicin, they lead to the cardiac toxicity. The cyclophosphamide leading to the hemorrhagic cystitis and sterility, while the metastatic state may cause hepatotoxicity. The differential diagnosis عندنا non-malignant condition نبديها بالجوفينال روماتويد arthritis، مرات يجي اللوكيميا على شكل يعني just limping or joint pain. Also infectious mononucleosis because of the lymphocyte هنا عالي، الجيباتيك ثرومبوسيتك بيبرا يعني الاي تي بي، وهذه البليتلت تكون هنا لو، فبالتالي يصير maybe misdiagnosed as ITP while it is ALL. So acute infectious lymphocytosis, aplastic anemia, pertussis and parapertussis because of يعني high level of the lymphocytes, and malignant conditions عندنا neuroblastoma, lymphoma, retinoblastoma, rhabdomyosarcoma, and acute myeloid leukemia. Now in the data gathering we have history، عندنا bleeding، تعرفون platelet قليلة فأكيد راح يكون cutaneous and mucosal, which is due to the low platelet count. Bone pain, arthralgia, limb, this is due to infiltrate disease of the bone, fatigue and pallor, which is because of anemia. and stridor, orthopnea, shortness of breath, or any other respiratory distress هذه بسبب mediastinal mass or pleural effusion. We have also oliguria and uremia, renal failure due to tumor lysis syndrome, as I mentioned before. Also ocular pain, blurred vision, photophobia due to infiltration of the leukemia to the orbit, optic nerve, etc. And we have also headache, vomiting, and seizure, which is due to the leukemic infiltration to the CNS. Now, what is the physical finding? We have pallor because of anemia, lymphadenopathy because leukemic infiltration, hepatosplenomegaly because of infiltration, bone marrow tenderness also because of infiltrations, petechiae, skin purpura, subconjunctival, and retinal hemorrhage because of thrombocytopenia. Also, we have palest testicular enlargement in the boy. This is due to infiltration of cutaneous nodule, infiltrations to the skin, and we have also extremity weakness, numbness or tingling. This is spinal cord compression. تلاحظون might cause because anemia or because of infiltrations or because يعني low platelet. In the lab investigations, we will see white BC in the CBC, increase or neutropenia, thrombocytopenia, low hemoglobin, and peripheral smear might show leukemic lymphoblast. احيانا نشوف الليوكيميك lymphoblast موجودة بالسمير بالبلاد فيلم. Also bone marrow aspirate, this is diagnostic if we find more than 25% of leukemic lymphoblast, and immunophenotyping and cytogenic studies on the bone marrow for diagnosis and prognosis. Biochemical abnormalities as I mentioned above, عندنا hyperuricemia for example, chest x-ray and CSF exam with lymphoblast. This is when there is CNS involvement. Prognosis and prognostic factor. Remission induction when the present therapy good. عندنا 95% كremission inductions, while the long-term survival approach also to حوالي 80% 80% of the cases. Prognostic factor, patient with the following criteria are high risk for relapse and require more intensive treatment. Those aged less than 1 year or more than 10 years of age, white PC count at the diagnosis more than 50,000. اوكي عندما يكون عندنا ترانسلوكيشن بين التي 922 والتي 14 و1 19. وايضا ممكن يكون عندنا الكوز اوف كرايتيريا فور ريسكي is hypodiploidy من يكون عندنا الكروموسوم اقل من 46 كروموسوم. And therapy, this is according to the risk factors. Risk assessment based on the clinical features, biological characteristic of lymphoblast, and bone marrow response to the initial therapy. فيقسموها إلى low risk, standard risk, high risk, very risk. Overall سواء كانت بكل high risk هو راح تكون عندنا phases 4 phases of therapy, كل وحدة بيها indication وكلها treatment خاص. For example عندنا induction اللي هو أول stage، هذا راح يكون at the hospital for 1 month، ونبدأ بنكريستين وأيضا سايتوسين و ادريامايسين وغيرها من الدراجز، وأيضا ممكن supportive treatment. In addition to the second stage is consolidation and then delayed intensifications and the maintenance. Those are phase stages. كل stages بها علاج. induction يكون بالهوسبيتال، وأحيانا يصير readmission to the hospital for any cause، وفي كل الأحوال بقية الستيجز راح تكون بال at home. Okay, now in acute myeloid leukemia, this is the 7th most common pediatric malignancy. The incidence peak at the 2 years, again 16 years. Boys and girls are equally affected. The bone marrow aspirate must contain here, notice more than 30% of myeloblasts, and they are classified according to the French, American, British. فيسموها ال FAB إلى 7 types، M1 إلى M2 M3 M4 إلى حد ال M7، وكل وحدة بها خصائص معينة ما أريد أدخل في تفاصيلها. Now in the history of the physical examinations We have fever, pallor, weight loss, fatigue, bleeding, bone or joint pain. There is also sign of anemia as pallor, fatigue, dyspnea, and sign of infection as fever, bacterial infection of the lungs, sinuses, skin. Another examination sign as hepatomegaly and splenomegaly, lymphadenopathy, gingival hyperplasia, and papillary edema. While in the laboratory finding and therapy, also we have CBC, there is low hemoglobin and platelet, and white BC increase or decrease. While in the peripheral smear, we might find myeloblast. When bone marrow bone marrow aspirate is diagnostic when we find more than 30% of myeloblast. In the therapy also there is induction, or usually by anthracycline as doxorubicin. This is an consolidation with the cytosar and AL asparginase المينتنس VIP 16. طبعا الدراكس ما مطلوبة من عندكم تحفظوها بس تاخذون عليها فكرة. The duration of treatment is usually 6 to 9 months. Just remember that allogenic bone marrow transplant may be the best treatment for AML in the first remission. Thank you and good luck.